In this video, we're going to demonstrate the insertion. You're going to locate the point first, and then remember after you disinfect the skin, the medical waste will never go back to the clean tray. So you need to leave it on the other tray. After insertion, you're going to hold the needle firmly. You're going to push fasting, goes all the way in until the patient can feel the feeling. So when you put in, you don't rotate. You don't rotate in. Why you can't put in? Because you didn't hold the needle firmly. All what you need to do, hold the needle firmly and then you can push. If you hold very loose, the needle won't go in. That's why you rotate. It is not suggested to rotate. Push in first until the depth that the patient can feel the qi or the numbness, the heaviness, that kind of feeling. So that's the insertion. After the insertion, we're going to use some manipulation methods. The first one, lifting and fasting. Again, you're going to hold the needle firmly. Lifting, fasting, lifting, fasting. In the meantime, you can communicate with the patient. The second one is rotating. Rotating, you're going to hold like this. Your thumb forwards, backwards, forwards, backwards. We will never rotate more than 330 degrees. After these two manipulations, you can choose which one you want to use. You also can combine them. Rotate and lifting. We still have some auxiliary techniques to achieve the qi. The first one, pressing. Pressing, we're going to press along the meridian. This one is the large intestine. So we're going to press along the meridian. Along the meridian. You can tap or you use your thumb to press along. It can help to achieve the qi along the meridian. The second one is plucking. You can use this or use your fingers. The next one is scraping. Scraping, you put your thumb on top of the needle. Use your nail, scrape the tail. The second way is use your index finger. So that's the third technique. The fourth, you can shake the needle. You shake the needle, that also can enhance the effects. You can say shake left and right or different direction. Shaking can divide it into two. This is one. You shake while the needle is straight. You also can bend the needle and shake if you want to enhance more. Trembling. You just hold the needle firmly and tremble your hand. With similar frequency. And the last one, flying. You're going to rotate and then relieve. These are the basic techniques for needle insertion and to achieve the qi. Apart from this, we have reinforcing and reducing methods that's used for tonify or to purge. So if someone got deficiency, we want to use reinforcing method. If someone got excess condition, we can use reducing method. So how to achieve that? The first one, rotation. Rotating, all these techniques will be achieved after De Qi. So you need to insert first until the patient feel the De Qi sensation. Then after De Qi sensation, you can rotate. For reinforcing, we will rotate with smaller degree, so we don't rotate a lot. The reinforcing and reducing, these two are opposite to each other. So when you remember one, then remember two. If you remember two, you're going to confuse. We will never rotate too much. So you rotate smaller. First, smaller, with very light force. As you can see my finger, I don't hold firmly. Okay, that's how when I hold firmly. Very light force, very slow frequency, very quick. That's for reducing. And also when I manipulate the needle, very short period. So there are 5 aspects for the reinforcing using the rotating. First one, you need to wait until De Qi. Second is the ankle. You don't rotate too much. You don't use a lot of force. Very slow. And also the manipulation period short. The second is lifting and thrusting. This lifting and thrusting you also can use for reinforcing and reducing. For reinforcing, so in the video, we only show you one technique for reinforcing. Reducing, just opposite. Lifting and thrusting. If you push in harder, it's reinforcing. When you lift lighter. Reinforcing, push harder, small amplitude, slow frequency, and also short period. So what kinds of, for reducing, we have bigger amplitude. For reinforcing, smaller. So also 5 aspects. We're going to insert first. We're going to use heavy force to thrust and light force to pull out, to lift. Small amplitude, slow frequency, and short period. That's lifting and thrusting. Apart from these, we also can use the direction. The direction will depend on the meridian. If the needle tip pointing to the same direction of the meridian, that's reinforcing. For example, this point is on the large intestine. Large intestine meridian runs all the way from your finger to your shoulder. If you use this direction, so this meridian runs from this way all the way up. If you use the needle is pointing to the meridian flow, that's reinforcing. That's similar, you add one branch from somewhere to add the qi to the body. If you use the other direction, if you insert in this direction, that's reducing. It's very similar, you add another branch from the flow, the whole flow goes to here, they're going to separate from the needle and to the body. So you actually reduce the flow in the body, that's reducing. The second one is from the respiratory. For that, you need to ask the patient to take a deep breath. Breathe in and out. For reinforcing, you're going to tap the needle. That's for the insertion. You're going to tap the needle as the patient breathes in. So breathe out. Can you just do deep breath in and out? As the patient breathes out, I will tap the needle. That's reinforcing. And then when I withdraw the needle, also to ask the patient to take a deep breath. Can you take the deep breath? There you go. So once the patient do the inhale, I will take the needle out. That's also the reinforcing. So for reducing, I will insert the needle as the patient breathe in. So just opposite. Open and close, I'm going to show you last. I'm going to show you there's a one even manipulation. Even manipulation, it means it's not reinforcing and not reducing. So you use the same frequency, the same forwards and the same backwards for rotating. When you rotate, it's same direction. That's even. So even used for some patient with not obvious deficiency or obvious excess, then you can use. The last one is the open and close. We're going to show at last. Apart from this is the comprehensive technique for reinforcing. We're going to divide under the skin for 3 levels. We're going to insert to the superficial, medium, and the bottom. Each level we're going to use for 9 times. So how do we perform? You can use different kinds of reinforcing methods for this. So we're going to insert the needle to superficial level, and then I use reinforcing methods. 1, 2, I push harder and slow. 1, 2, 3, 4, 5, 6, 7, 8, 9, and then go to the medium. 1, 2, 3, 4, 6, 7, 8, 9, and then go to the bottom. Again, 9 times. After the third one from the bottom, you can repeat again. Then you will remove the needle to the superficial. You will lift it to the superficial, and then you can start the process again if you need to. Okay, so that's the setting the mountain on fire. It's a kind of comprehensive reinforcing technique. The next one is the penetrating heaven coolness or cooling the sky. That's a comprehensive reducing technique. We're going to put the needle all the way to the bottom. We're going to manipulate 6 times at each level. So we're going to put to the bottom 6 times. 1, 2, 3, 4, 5, 6. And also because this is a reducing method, so you can perform faster the speed. 1, 2, 3, 4, 5, 6, and superficial. 1, 2, 3, 4, 5, 6. If you want to repeat again, you can. You put it back to the bottom, and then you start again. So these 2 are the comprehensive technique. So lastly, I'm going to show you the open and close reinforcing and reducing. For reinforcing, when I remove the needle, I will remove the needle directly, and then I will use the cotton to hold the hold on the skin. So that's reinforcing. For reducing, I don't want to hold the needle. I don't want to press the skin. Even I want to create the bleeding if possible. So for reducing, reinforcing, you can just remove the needle directly. Reducing, you're going to shake the needle. You just think you want to get a bigger hole on the skin. Shake the needle and remove the needle. And you don't press. Even if bleeding, here you got slightly bleeding, you just leave there for a while and then you get the blood away. If you got more bleeding, that's still fine. You can just let the patient bleed for a while, and then you press the blood. So this point is not proper for the long needle. I'm just going to show you how to do that for the double hand needling technique. For the long needle, we normally use for area with the thicker muscles, such as on your bump, GB30, and or sometimes at the lower back or in the upper leg in the thigh. So for this point, I'm not going to insert, I'm just going to show you how to do. The same insertion. Okay, now when you remove the tube, the needle just too long when you push. It may bend. So what you're going to do, you might wear gloves. You still need to disinfect the gloves, or you might hold the wool cotton, or you disinfect your finger. So my finger has been disinfected. You're going to hold the needle. Okay, you're going to use the other hand to hold the needle and you push. Still the same, you hold the tail firmly, you can push in. So that's the double hand insertion with long needles. Because future needle, so these two are 3 terms but different width. This one is 0.3, this one is 0.6. Okay. You still have the one even longer. So this one is 10 centimeter. Also 0.6. You also can use for GB30 or in the area.